Hi guys, today you're welcome to this channel, and today we are having a medical worker that is supposed to talk about some important and crucial things that are affecting the health of Uganda, and that's monkeypox and probably Ebola. As we know that Ebola is a deadly disease of which when affecting 100 people, at least 90 can die because it has no curative. Some medicine that you can take and you get healed. Same applies to monkeypox because they are all almost in the same category of viruses. What I want her to help us with, she will introduce herself probably. However, what I want her to help us with is how are they spread, the causes, the signs and symptoms, predisposing factors, how can we really avoid it? And those are things that I want her to enlighten about. And let's know as communities, as where we stay, let's know how we can avoid this, how we can go about this, and we stay in a safe community and be safe. Me and you, when we are safe, we can lead the country and we can prosper well. Health is an important, crucial thing that we can take caution of. Mrs. Brenda.
Thank you very much. My name is Brenda Explains. I'm an epidemiologist. Basically, what I do is a research on disease in communities.
Yes.
We find the disease, we find a solution to that disease.
Yes.
That's what I do.
That's great. Now, Brenda, today we are going, I want us to talk about things that really affect the community, because there are things that, yes, affect the community and the hospitals alike. But I want us to enlighten more about the things that affect the community and probably the causes, because these things happen in the communities. If at all someone wants to know what, or if at all you go and tell someone what monkeypox, how could someone understand it, that this is monkeypox? In a nutshell, I think in the definition, we can. What is really monkeypox?
So monkeypox is or Mpox is a viral disease.
Yes.
It is caused by the same it's in the same family with smallpox.
Okay.
Being viral means it is caused by a virus. It is usually it is manifested through rashes and later big lesions on someone's skin. Someone can have fever, persistent headaches, severe headaches, persistent cough, sore throat, and symptoms can go on even up to death.
Okay.
Yes, so that's basically what monkeypox is.
Okay. Someone may want to know. Yes, you've talked about the rashes. How severe can the rash be? Because in most cases, even in measles, they tell us that you can receive a rash. How can someone differentiate that? Okay, my child is suffering from monkeypox, or me myself, because even old people do get measles and they can be affected by the rash. How can someone notice that this is somehow different? I might be dealing with monkeypox.
So the measles rash begins usually with the face.
Yes.
And what makes it different from the other rash, the Mpox rash? The Mpox rash, soon the measles rash will not progress to bigger lesions, but the Mpox rash soon become so big.
Okay.
And we call them like a donut shape, becomes like donut shape.
Okay.
But also it begins from the peripherals, like the fingers, the feet. Yeah, and the measles rash will never be here, but you find this one becomes bigger and bigger, and they become like big, I would say like big wounds. So that would be the difference. But in the beginning, now that we are in a season of Mpox, once a person begins to get a rash and also begins to get fevers. By the way, Mpox rash, the last thing you see actually is the rash coming. Usually the other symptoms are there, the fevers, the headaches. So when someone begins getting this rash, this Mpox rash, it is usually now towards the end. The disease has already started. So it is very important that when someone gets any of these symptoms, visit a health facility. The health worker will determine whether it is measles or it is Mpox, because it may be hard for you to tell as an individual. Yes.
Okay. How is Mpox spread? Because yes, we've talked about the signs and symptoms, as someone can have fevers, the rash and the lesions, and we've talked about other things. So how can someone, what is the mode of spread of this Mpox?
The mode of spread is contact. Yes, contact can be body-to-body contact. It can be if you get in contact with an infected person's fluids. That can be the mucus, the droplets from the mouth. It can be blood, it can be urine. But as long as you get into contact with the infected person's body or fluids, you can get Mpox.
So meaning when I am sick and I get into contact with you, you're prone to getting the
Yes,
disease.
you're prone to get the disease. If you kiss someone, if you have sexual intercourse with someone, if you hug, if I get in contact with your sweat, you're exposed to getting the disease.
Okay.
Yes.
Talk about the animal side.
Oh, so sorry, that is human to human, from one human to another. But also we have animal. By the way, Mpox, the reservoir for Mpox, I didn't talk about this earlier. The reservoir for Mpox is animals like squirrels, bats, rats, monkeys. So it is basically what we call the zoonotic disease. It's in animals. But how does it come to a human? If you get in contact with their blood, probably a slaughtering, or their fluids, or if you eat that animal. That is how it moves from the side of the animals to come into the humans. So when it gets to humans, now it is contact.
Probably which animals directly? Because someone will ask, if at all we mention about animals, they may say cows, they may say goats,
squirrels, monkeys, bats. Yes, that's basically the ones that usually have.
So I just want to let you know that the main reservoir of as she has said, the main reservoir of Mpox, that is the virus, is the animals. So when a human being gets into contact with the animal itself, they contract this virus, and when they contract, the spread goes on human to human, right?
Yes.
If I'm
that's
right
how
to
it
say
moves
that.
from one human being to another.
Yeah. Could we mention the predisposing factors?
Predisposing factors: one, eating animals. Okay, eating these animals or staying around them. Another predisposing factor is contact. As long as there's someone infected around you, you're predisposed to the disease. Then also low immunity. If someone has a low immunity, chances are high they will get the disease. Okay, that doesn't mean people with the
stronger immunity
can't get, but the other person has more chances. So basically that is it. As long as someone is in contact. And by the way, amazingly also, as a country or as a region, we are predisposed by the fact that we stay near monkeys, we live with them. That alone predisposes us to the disease, because anytime
you can
get it. So squirrels, anytime you can get close, which we call kamuji.
Yeah, probably there are some people that eat those things.
Thank you.
Yes.
So we are in our setting, we are predisposed because we are very near these animals. Yes.
Okay. It can be second last on Mpox. How can we really? People have known how they are spread, how it is spread, how are the signs and symptoms. Yes, if at all they have known the causes. If at all someone gets it, you know, you've told us that we can visit the hospital. The health workers know how to assess them. Probably you've mentioned onto the signs and symptoms. So, how can really someone, I don't want to get affected by Mpox. How can someone get avoid this? What are the ways can I use as a person in the community to avoid this Mpox?
Okay. One thing I didn't mention is that another predisposing factor is living in very close communities. Yeah. Even things like schools. If if a child with Mpox comes to a school, you can be sure many children will get it because of the way they live. They line up for food. They in the dormitories, they're together. They play together. So one of the ways, let us stop being very close, hugging, greeting with handshakes. If someone is not well, do not handle their. In our culture, we take care of people. If someone, your relative is sick, you want to get in, you want to even wash the fecal matter. It is just care, but be more careful now. You can use gloves. Gloves are not very expensive. I know that a pair in pharmacy is about 500 shillings. Now, I know in some areas someone may not afford, but rather than get sick, at least use. That is if the person has been actually confirmed. Let the health workers handle. If you're home in this, especially now that you know there's Mpox, we are in an area of Mpox, be more careful. Hand washing, some of the simple things, hand washing with soap. Yes, all the time, not just when you've touched someone. No, let us get into the culture of washing hands. Someone who can afford a sanitizer, that one also can be used with time. So basically, if you cut contacts, you can cut the spread. The other important aspect is vaccination. Mpox has a vaccine. If you're able to be vaccinated, the Mpox vaccine is a 2-dose series. You get 2 doses, one and then 30 days later another. So if you're able to, and the vaccine by the way is in the country. So if you get a vaccine, if you get 1 dose of the vaccine, you have at least 76% protection. Which means you may 7 times out of 10 you may not get what? The virus. Disease. And even if you got it, say if you got it, you may not, it may not go into severe stage.
Yes. You may not get the rush.
And by the time you get, the second dose, the protection has increased to 82%. So those are ways we can avoid. Yes. But mostly, let us keep. But even when you've gotten the vaccine, that doesn't mean, how can I say it? Just because you are protected against something, I mean you should be careless. All these things work hand in hand.
Yeah, probably.
Don't shake.
That goes to it reminds me of the people of safety. I mean, road safety. They say that you put on the things, the protective gears, but you shouldn't get prone to accidents. Yeah.
So just because you have a helmet, don't be careless. Don't move around very careless.
Yes. Don't move around very careless. Okay. To the health workers, I just want to hint out this. I hope so you can talk about it very
to the health workers.
Yeah, to the health workers, because I personally do some trainings about IPC.
Okay.
So it is more crucial for health workers to strengthen IPC. I just want you to just hint on it, just a very little bit about IPC in the facility and how they can avoid also the spread, first of all, then second, how they can avoid getting Mpox to themselves.
So this is what is very important in a hospital setting. IPC is a must.
Yes.
Not only for Mpox, not only for a particular disease, but for all. It protects the health worker, but it also protects the other patients.
Yeah.
You don't want to come to hospital with a cough and live with Mpox. Okay? You don't want to come to hospital with a cough and live with any other infection. Okay? So in hospitals, it is basically IPC. Infection control and prevention, there are so many procedures. The cleaning, the gloving, there are so many procedures. All I can say is that IPC has, because these are things that have been trained to health workers. I may not mention it all, but health workers know, just be vigilant all the time. At no point should we put our hands down. Like I told you earlier, as a country and as a region, we are pre-exposed to most of these infections. So we don't have that time to relax. You have to keep doing things the way it's supposed to. You have to keep cleaning, because you just don't know when the next Ebola case may walk in as if a fever, or the next Mpox case comes in, you treat as if a fever. Then 14 days later, you see, it was a Mpox. When you were careless. So yes, so it is IPC, be vigilant, don't give up. That is what I can say.
Probably that draws me. I would like to first of all thank you for giving me this ample time, but that